Hi, my name is Mercedes. I am 24 years old. Um, I I guess, joined YouTube and started to want to post some videos because I recently had um, gastric sleeve surgery or laparoscopic sleeve gastrectomy, whatever you want to call it. Um, I am about 5 foot 5 inches, and um, before surgery, well, actually, before the pre op diet began, I weighed 262 pounds. Um, After the pre op diet, I lost a couple of pounds, and I was at 258. Um, and I had surgery on May, I mean, yeah, May. I forgot what month it was. May 3rd. And the day before surgery, I weighed and I was 258. Today is the 14th. It's almost been 2 weeks since surgery. Um, I had a lot of complications. I didn't have a leak, but I wish that someone would have went over more of the complications, I guess, before surgery to kind of, I didn't feel like I was really prepared, I don't think, for this. I mean, I obviously knew what the surgery was. I'm a surgical tech, so I know what takes place. I've actually seen these surgeries performed in the OR. So I know what takes place during surgery. It was the recovery, really, that I wish that maybe someone would have went over with me better. um, I guess I should take you through my little story of my surgery to let you know kind of what happened. So I went in that Thursday to have surgery, had surgery, everything went fine, nothing, no complications, I woke up, started eating some ice chips as I could handle them. Uh, then the next day, or I didn't have anything that day. Then that morning, they did the swallow study. Everything looked good. Then that day after the swallow study, I got ice chips. And I was, snacking on ice chips, drinking a little bit of water, not very much though. And then by dinner time, I was actually able to have a liquid diet tray. So I got broth and jello, and I was able to eat just a little tiny bit of each thing. But that was it. I mean, maybe a couple of bites of each, which, that's kind of expected, I guess. Um, but then I was discharged from the hospital because everything looked fine. Well, the next day, I was trying to drink fluids, trying to stay hydrated. My grandmother was taking care of me, and she was constantly telling me, you need to drink, you need to drink. So um, I was drinking, and it just felt like every sip I took, I was just going to throw it up. And I was dry heaving because the liquid would go, straight through my stomach practically. It wouldn't stay there very long. And I was just wanting to vomit constantly. I was taking Zofran. They prescribed me Zofran and Lortab, the liquid form, and dissolvable Zofran to take home. And uh, I was having really bad acid, kind of reflux issues too at the time. I don't know what exactly why that happened, but anyway, so I wasn't able to keep anything down. So I told my surgeon, and he decided that he wanted to readmit me into the hospital. So that was Thursday. Had surgery. Friday, I was discharged from the hospital. Saturday, I was readmitted to the hospital and ended up staying until Monday there because my stomach was so swollen from surgery, from the trauma, of surgery, that it was so swollen I couldn't have anything by mouth for those couple of days to let the swelling just go down and open up and allow me to eat finally, or drink, I guess you could say. Um, So that was really hard, and I wish that someone, I guess, would have let me know that that's a potential complication, um, right after surgery. And then um, I started feeling better. They, hydrated me with IV fluids, and things seemed to be getting better. And then I came home. I got discharged on Monday. I came home. Pain, pain was pretty intense. I mean, I've never had any kind of really major surgery, so for me, this was the worst pain I've ever had in my entire life. Um, it was excruciating, and I um, I would just not be able to move. I felt like, especially if I didn't have my pain meds. And then I was having when I was in the hospital, I had trouble urinating right after surgery, and they had to catheterize me. I don't know if that was maybe the anesthetic. Things weren't really working right after surgery. Like, things weren't moving. I wasn't able to urinate. And then afterwards, after surgery, when I came home, I was having really bad gas issues, and I hadn't had a bowel movement, and it had been like 6 days after surgery, still no bowel movement. So I'm like, what's going on? Are my bowels ever going to move again? Am I ever going to use the restroom? I was kind of concerned, and the pain was getting pretty bad because the pressure was just building up in my abdomen, and it was pushing on that incision on the left side, um, and it was hurting bad. And I was to the point where I didn't know if I could take it anymore. And so I called my surgeon, and he said, take some to try an enema, try magnesium citrate, because he told me milk, if I don't have a bowel movement in a couple of days, take milk and magnesia. Well, I took that, and I threw it up because the pressure was so intense in my abdomen. I could barely, I was to the point where I was barely able to force anything down. Oh, excuse me. So, um, milk and magnesia didn't work. Tried an enema, that didn't work. Uh, Tried the magnesium citrate, threw that up, and I was to the point where I was ready to go back and get checked back into the hospital because I didn't think that I could eat anything or drink anymore unless I got something out. I needed something to come out of my system. And so last try, we decided, okay, well, I'll try a suppository, and thank God that suppository worked because it was like relief instantly. It was like, oh, no more pressure on that incision. It felt better. But then I still wasn't able to go regularly for the next day or two. I had to use suppositories anytime that the pressure started building up. I had to put a suppository in to try and have some sort of movement to get my bowels moving. So it took a few days for my bowels to start moving again. But let's see, today's Monday. So Tuesday, Wednesday, Thursday. So in 3 days, it'll be 2 weeks. And so my first week was probably the most miserable time of my life. I was not prepared for it. It was horrible. And honestly, like at this point, I would not even want to suggest this for people. Like that's how hard this past week and a half has been for me. And I'm finally starting to feel normal again. And I'm kind of starting to deal with more of the psychological issues that go along with having this done. The addiction, dealing with the addiction, and thinking about how my life's going to change. I mean, my life has already changed, but how much more my life will change. I am addicted to food, I'll admit it, now that I've, been able to sit back and look at myself a little bit and I'm a food addict, and I used to be able to eat a whole pizza, like all slice, a whole pizza. Just give me, normal size pizza, and I could eat every single slice. And I know that there's something wrong with that. You shouldn't be able to do that. But I felt like fulfilled after I ate that much. I felt like, oh, that was so good. And now I'm afraid a little bit that, I guess because I am a food addict, I'm scared because, oh, I'm not scared, I'm sad because I'm never going to be able to feel that way again. I can't think about, not eating pizza ever again. But I mean, I know I can eat toppings off of it, or maybe one of those extremely thin crusted one piece, if I can even, get that much down, piece of pizza. So I know I don't have to give it up for the rest of my life, but the enjoyment of being able to sit down and eat as much pizza as I wanted, it won't happen again. And it's kind of sad to me to think about that. And it's like I'm saying goodbye to, a part of me, I guess. And I guess that's part of the addiction part of all of this. But dealing with the different aspects, the mental part, the physical part, I feel like I'm finally getting some relief from the physical part of surgery, of having this procedure done. I think, I'll get through it. One thing that is kind of frustrating me, though, is I, I seem to have a lot more gas than before. I have hypersensitivity in my stomach. Like, I can feel the food go down my esophagus, and once it gets to my stomach, I can feel it sit there for a second before it enters my stomach, and I can feel it drop into my stomach. And when it drops in, there's bubbles that come up in my stomach, and then I burp. And it's like being able to feel that now. Before when I ate things, I just ate them, and I just stuffed my face, and I didn't think about where it was or what it felt like as it was going down. But now I feel like I really have to think about, okay, this is where this is. I can feel it go down. And I'm starting to advance to some softer foods like scrambled eggs and pudding I've had. And first time I had scrambled eggs, I had to sit there and think, okay, is it right there? Is it at my stomach? Is it going in my stomach? Can I feel the first few bites? You really have to think about, what does it feel like? Because you're having to learn your body's, I guess, signs all over again. The feelings that your body has, the feeling of fullness. You have to learn that all over again because it's so different. What hunger feels like. I mean, I felt hungry, I think, once so far, and it's so much different than it was before. Before, I felt like I was dying if I was hungry. I mean, my stomach was eating itself. But now, I haven't really felt that, which is good, which is, part of why I had the surgery. Um, but I still feel hungry a little bit, and I mean, but I don't feel like I have to eat when that hunger strikes. I don't feel like, oh my God, I've got to eat something or I'm going to die. That's how I felt before, and now I don't really feel that way. I feel like, okay, well, I'll eat because I'm a little hungry and because I have to eat, but I don't feel like, oh my God, I'm going to die if I don't have something right now. Which I'm grateful for. I'm glad that, I'm feeling that way. Um, but I just wish that someone would have told me some of the complications, some of the things that could happen with surgery, and kind of prepared me a little more for how your body kind of changes, how your stomach changes, your intestines. I can feel things a lot more now, I guess because I'm more concentrated on them. But it's definitely weird. It's an adjustment. Um, dealing with the gas, I've just been having, just built up gas. My doctor says that it'll go away. Um, but that's one of the things that is kind of irritating, and I can't wait till it goes away. And I can't really tell when I'm full or not yet. Um, I mean, I don't want to get to the point of fullness where I feel like I'm going to throw up because my stomach